thank you everybody for having me. I'm very excited to talk about this, especially given our recent climate over the last year. So we all have stress regardless, and then throw a pandemic on top of it. And it's a recipe for some big anxiety. Okay, so this is a quote I like to give always in the beginning of presentations. The single most remarkable fact of human existence is how hard it is for humans to be happy. And before I even get into this, one of the things that I like to say to people is that when you are dealing with any type of life circumstance, it's normal, it's the human condition to have anxiety, to have stress, to have sadness, and our efforts to stop those very natural emotions are usually what ends up being an anxiety disorder or a depressive disorder. It's that struggle against it rather than that willingness to sit with it and let it pass naturally. Okay, so let me just move this so I can see better. Oops. There we go. Okay, so managing stress during the pandemic. We're going to talk about two main groups during this. And the first is those who have been diagnosed with epilepsy. And the second, those who are caregivers of those diagnosed with epilepsy. Because during this very stressful time over the last year and more, it's not just patients with epilepsy. It is also very much their caregivers and who are the ones that are going out, getting medications, getting food, taking care of schedules, taking care of doctor's appointments. So in general, what is unique about epilepsy with regard to stress? So there's a couple things. First is the reaction to the illness itself. A lot of times when I work with patients who have recent diagnosis of epilepsy, there's this sense of lack of acceptance, this initial lack of acceptance, which is very common actually with many illnesses, this kind of pre-diagnosis and post-diagnosis life. And it's this acceptance of this change in the path, let's say, that you thought you were going to go. And now that you have a diagnosis, things have to take a little bit different of a course. So there's a large acceptance component to that. Difficulty adjusting to epilepsy in general, stigma and discrimination. As we know, a lot of times people are uneducated about what epilepsy is, what certain types of seizures look like, how to handle it. And it can be very scary to not only the person who has epilepsy, but also the people around them if they don't know what to do. There's also lack of control caused by random seizure occurrence and lack of social support. So epilepsy is one of those illnesses where I can see people that have been seizure-free for 30 years, but if you ask them what their biggest angst is, they're still going to say, what if I have another seizure? Or what if my cocktail of medications all of a sudden stops working? So day-to-day stress of epilepsy prior to COVID. So obviously stress about epilepsy didn't just begin when the pandemic hit, but you're routinely making appointments and special arrangements with your team, therapists, neurologists, and so on. It becomes a part of your, I don't want to say day-to-day, but it becomes a part of your schedule. There's also issues of memory concerns, driving restrictions, the job of educating others, which can feel very daunting at times, especially depending on who is in your support network and even outside of your support network at work, at other family events, when you go to college. Foods and diets are a big component to this. How do you function as a parent and have epilepsy? How does that affect your role as a mother, as a father? Your career. A lot of times there may be times where you need to call out of work. What do you say? Do you feel comfortable saying that you have epilepsy? Do you feel comfortable saying why you're out? Do you explain yourself to your colleagues? How do you explain yourself? What if you're surrounded by people who you don't want to explain this to or who won't understand? Medications is always a big stressor. recovery periods, and rest. Rest is a big thing. You must implement rest across all your day-to-day activities, because as you know, the more overtired you get, the more fatigued you get, the more stressed you get, you put yourself at risk for seizures and just feeling bad in general. So particularly with women continue to worry about their day-to-day responsibilities and how their diagnosis will impact them. And when this happens, they can experience a drain on emotional well-being that may impact them for some time to come. Again, because you're dealing with a condition that has a lot of kind of this sense of lack of control surrounding it, and this kind of uncertainty. It's on this intermittent reinforcement schedule, meaning you just don't really know when, how, and what. And when you're dealing with any type of situation that has that intermittent nature to it, it naturally is going to cause more anxiety. So in general, when you are managing an epilepsy diagnosis, you can't just turn it off. You have to make sure that you take time for yourself, particularly during this pandemic with all the stressors that are involved in that, which we'll get into. It continues, and it's even more important now to be able to take time for yourself, whatever that looks like. It could be just sitting in your room by yourself for 5 minutes. It could be just taking a walk to get the mail. So let's first start with young people with epilepsy. So when we're looking at the pandemic and we're looking at epilepsy, in addition, like I said, to situations that cause stress prior to the pandemic, they don't go away. And if anything, they're more pronounced now. So the first thing to look at is dating. When you have young people with epilepsy, young people are starting to get into dating others, starting to make plans with their friends to see other people. And it starts to be a time when low self-esteem starts to come to the surface, when insecurities start to come to the surface. So it becomes an issue of how you communicate, especially with young people, to your friends or people that you're starting to date. How do you communicate to them about epilepsy? How do you communicate to them what it looks like, or how it develops, or what should they do if you have a seizure while you're with them? What happens if you are sick for a couple of days or your medication's giving you side effects? So these are all things to think about, particularly in the social environment that we're in, and particularly with social media today. There's also increased academic demands, obviously, as a young person enters into college, enters into grad school, enters into the work world. And because of cognitive difficulties that can arise with an epilepsy diagnosis, this can cause a lot of added stress. Driving, obviously, is always a big one. Driving is a significant form of independence, and young people at this age in particular are craving independence. They are trying to do everything they can to break free from their families, from their parents, and driving is one of those ways in which they do that. So to have limited driving abilities, or to have your license revoked or not be given to you, or need somebody with you, this can really foster a sense of feeling out of control or feeling different from their friends. And also, going into college in general, we always worry about alcohol and drug use and overuse. This becomes even more important when you are on medications for epilepsy. Okay, so COVID and epilepsy. There are a lot of different factors involved in this. There are a lot of different groups involved with this. So I'm going to kind of pick this apart group by group and talk about how COVID in particular is going to affect that group when we're talking about epilepsy. So essential workers versus caregivers. If you have a caregiver, let's say, who is an essential worker, who stays home if help is unavailable to come to the home? If somebody needs to go to work, if the primary caregiver needs to go to work, who's going to stay home if the other person is either home from work because they're not allowed to go in, or their kids are home from school? It becomes a really stressful situation. And I saw this a lot in my practice, this kind of juggling act of who is going to stay home. Also, single parent households. If your children are home, you have nobody to watch them. You need to go to work. Or if you can't go to work because you are sick or because you have a seizure, who's going to be taking care of the kids when the kids are not in school because of COVID? And I'm sure this was spoken about, but as far as a compromised immune system, people with epilepsy are likely to be at a little bit of a higher risk because of this. And so they have to take greater precautions. And this is going to mean more isolation. And with isolation, as we know, comes increased depression and increased anxiety. And again, if you need to stay home, and let's say you're married to somebody or your caregiver is an essential worker that had to go in, and you need somebody to stay home with you, who's going to do that? If you can't drive, who is going to take you places? So all of this becomes something that is not just a one-person issue, but it becomes a systemic family issue as well, and within your support network. You're already at a higher risk for injuries, and so what happens if you injure yourself somehow and you have to go to the emergency room? Now you're putting yourself in a situation where you're in an emergency room when there is a pandemic going on. So again, it's kind of put you in the situation where you're already at higher risk, but yet if you get injured, you need to again put yourself in a situation with higher risk, and it becomes just this back and forth battle. And then just because there's a pandemic doesn't mean that illnesses just cease to exist. They still exist. Doctor's appointments still need to continue. Your scans still need to continue. Your blood level checks still need to continue. You don't stop taking your meds just because there's a pandemic. So all of these things become not just everyday stressors, but now they become stressors plus a higher level of danger associated with them. Plus just the day-to-day, who's going to take me, who's an essential worker, who's home, how am I going to get there? Also, important lifestyle adjustments. What happens if you have a medication change during the pandemic? How are you going to get your medications? You need to go to the doctor, which means you're placing yourself in a doctor's office during a pandemic. Same again with ER visits. Dietary needs in epilepsy is a very big component. How are you going to go to the market? Can you go to the market? Certain specialty stores have been closed and still remain closed. Delivery times have been exceptionally slower. Things that maybe took a day now are taking a week. What if it's something that you need immediately that you used to overnight? Again, if the person who drives you or is your caretaker can't get there because they're at work. So again, it leaves this kind of gap where nobody really thought about any of this because we've never had to. And now that we're in this situation, things, like I said, even down to Amazon delivery time or mail-in prescription times are significantly slower. So it's just another thing that has to be remembered or thought about. So we talked about compromised immune system. So virus transmission, again, is a concern for everybody, but in particularly people with epilepsy. Financial fears. This was true for everybody. However, again, when you're dealing with an illness that is something that you are always going to have, your medical bills, your health insurance are always variables that are kind of in the forefront of your mind. So during COVID, what happens if you lost your job? What happens if your spouse lost their job? Your parents lost their job? How are you paying for medical bills? What are you doing now for health insurance? And again, what we know about stress and epilepsy, the more stress you have, higher risk you are for putting yourself in a situation where you could have a seizure. Maintaining a safe household, again, is always something that we want to be aware of. But what happens when there's a pandemic, people are not working? Now you have way more people likely in the house, including maybe younger siblings who aren't the most careful. A spouse is home when usually they're traveling, let's say. So you're used to having your household set up a certain way with safety in mind. And now, as I like to say, there's too many cooks in the kitchen. And with that, you have to maintain the safety precautions that have always been there. So it involves a lot of education. It involves a lot of eyes. And it can be, again, a daunting task. Changes in routine. We all have had significant changes in our routine since last March. And as creatures of habit, we don't like changes in our routine. And when we are dealing again with an illness such as epilepsy, routine and structure are so, so important. One, sleep. When sleep schedule gets thrown off, you know, it's one of those things, again, lack of sleep that can put somebody at risk for having a seizure. Not taking your medications in the right order or at the right time, not eating at the right schedule. If you have an exercise routine in place, not doing that in the same routine anymore. So it really kind of, again, takes additional energy and a lot of effort to maintain your schedule as is. Now throw a pandemic into place where everything is up in the air. Can we go out? Can we not go out? Do we wear a mask? Do we not wear a mask? Should I go out at all? Should I not? Should I allow this person in my house? Should I not? I can't get to the pharmacy. The pharmacy can't deliver in time. So changes in routine are unavoidable during the pandemic. So it's very important to, as best as you can, maintain what I like to call as much of your pre-pandemic routine as you possibly can. Okay, so again, just like illnesses don't stop during a pandemic, neither does wanting to have a child, neither does being a parent. So let's talk a little bit about family planning and pregnancy during COVID. One, it would be normal to have more anxiety about this during a pandemic. It would be normal to worry more about this during the pandemic, and it would be normal to want to contact your doctor more frequently than before the pandemic, and again, all normal. So one of the things that we have to keep in mind during family planning stages, early and during pregnancy, during COVID, routine doctor appointments. Again, you are putting yourself in a situation where you are likely going into a facility where people are sick. Even something like, do you stay in the hospital when you're giving birth? How is that going to work? Who's allowed in, who's not allowed in? Is it going to put you more at risk for having a seizure? Is it even something to consider having the child at home? Which again, because you have a medical illness, probably would not be the smartest thing to do. So you do have to be in a hospital. So again, it's all these kind of new ways of navigating your environment that we never would have thought of before. Then there's the decision of delaying pregnancy. And I worked with actually a couple women on this who were trying to get pregnant. The pandemic hit. And then there was the discussion of, well, should we delay pregnancy? Should we delay trying? And I think most of them did, actually, now that I'm thinking about it. However, it's not just as simple as we're going to delay trying for a baby because of the pandemic and, you know, the virus itself, but also maybe a spouse or significant other lost their job. So having a baby now is too much financially for the family to handle. Let's say that you have fertility issues. Fertility issues involve going to doctors, going to so many checkups constantly. So again, you're putting yourself in a situation where you have to go into a doctor's office, you have to go into a hospital where you're higher risk when there's a pandemic going around. And fertility specialists, you know, all of their procedures are very time sensitive. So if you delay, there's that idea of, you know, you're putting it back months and months and months. We're not talking just a month. People that wanted to adopt ran into this. There were significant adoption delays. And this was very hard on people because it's already a process as it is, put a pandemic into the mix, and the delays were kind of push people back years. And again, I already talked about fertility treatments, but the timing aspect of fertility treatments is so sensitive. And so when people make the decision to delay when they're dealing with fertility treatments, it's a very big and sometimes very upsetting decision to have to make. So let's talk a little bit about the impact on the lives of caregivers during COVID. In general, they're going to have much shorter socialization, much lower visiting times with friends. This is due to social distancing and the restrictions that are there, because obviously if you are a primary caregiver for somebody, you have to be very careful where you go, who you see. Do you go to the market? Again, do you go to the pharmacy? Do you go to your doctor's appointments? Do you go to other family members' houses knowing that you're going to be coming home to your home? Regularly scheduled appointments that you would have if you were a caregiver, let's say that you're on a very strict schedule with, now once again are up in the air. Let's say every Wednesday you went to the gym because that was the time that you were able to go. You can't go anymore. You can't get your hair done. You can't cook meals the way you wanted to with the types of food that maybe the diet allows for, because you can't get to the specialty stores. Even things like book club, your social outlet. Let's say that every week you had a book club on Wednesday nights. You can't go anymore. And yes, people got creative. There were book clubs on Zoom and we did things over FaceTime, but it still really is not the same. And also remember, like I said before, there's more cooks in the kitchen now. There's more people home in the household. Also, people lost their jobs, so they may not be able to go to the salon. They may not be able to go to the gym, even more so than taking care of somebody, let's say, who has epilepsy or any illness for that matter. There's a huge financial component to this as well. Any in-home help or aid may have been halted because of COVID. Let's say that you had somebody come into your house to help you, to give you an hour to yourself, but now they're not coming for whatever reason because of COVID, or they got sick, or someone in their family got sick, and so therefore they can't go to work, they can't come to your house because they were potentially exposed to somebody. So it's not just you and a spouse, you and a caregiver, you and a child. It's everybody else around them, which prior to COVID wasn't even on our radar. So mental health, obviously mental health this has a huge impact on our mental health. There's significant increase for anxiety and depression as a caregiver and a person with epilepsy, which is even higher for all the reasons that I spoke about during COVID. More social isolation, lack of finances, fear of loss of job, weighing the cost-benefit analysis of pregnancy, of my meds aren't working. Do I go to my doctor's appointment? Do I do a telehealth visit? Who's going to take me? The idea of no one understands me, this is something that is very common with people with epilepsy. And during COVID, this became an even bigger concern because while people were maybe taking some risks that they shouldn't have been, people with epilepsy and their caregivers really were taking none. The impact that this has on marriage is substantial. There's, again, more cooks in the kitchen, so there's more fighting between family members, there's more stress, there's more anxiety, and whenever that happens, combine it with job loss. We know that people were drinking more during the pandemic. We know people were at increased risk for drug use during the pandemic. So all of this together is going to have a significant impact on family. And then worry, like I talked about, worry is inevitable. And that's why I said in the very beginning that it is normal to have worry and anxiety during this time. And if you didn't have any anxiety and worry, I'd actually be more concerned that there was some sort of heavy avoidance going on. So worry about finances, job, insurance, and health are all there prior to a pandemic when you have an epilepsy diagnosis, but even more so now. Some common psychological conditions in women with epilepsy. Again, these top two, depression and anxiety, got considerably worse during the pandemic for all the reasons that I spoke about. Mania, psychosis, and personality disorders. The one thing with personality disorders that I always just like to say is that sometimes what appears to be a personality disorder in someone with epilepsy could very much be due to a side effect of medication. And so it's very important for psychologists, mental health providers to look at the signs and symptoms and see if they had been there way early on in the person's life, or if it's something that started more recently since they had been on medication. Suicide rates, we know, 5 to 10 times higher in people with epilepsy, and it's up to 25 times higher in people with focal impaired awareness seizures versus the general population. Suicide rates also did increase in general during the pandemic, so that did increase as well for people with epilepsy. So some quick facts related to caregiving in general, I just want to talk about before we go forward. Family caregivers who provide 36 or more hours weekly are likely than non-caregivers to experience symptoms of depression or anxiety. For spouses, the rate is 6 times higher. For children caring for the parent, the rate is twice as high. That's a lot. When you're looking at illnesses in general, this has one of the highest rates. Common symptoms, again, associated with caregiver stress. I touched on this, but again, I want it to be known that these symptoms, depression, helplessness, hopelessness, anxiety, all escalated during the pandemic. So, conflict with spouse, children, and extended family. This is something that I saw a lot of in my patients who have epilepsy during the pandemic. There was just, again, all of that extra stress, everything down to delivery times are slow, to loss of job, to decreased socialization with friends. It caused a tremendous amount of conflict within the home. Unfortunately, domestic violence rates went up, and child abuse rates did go up as well. However, in the very beginning of the pandemic, there was a press conference, and I remember watching this, and I wanted to jump out of my skin. They were saying how the rates decreased of child abuse. And I remember sitting there, kind of, that's not true. And instinctively, I know that's not true. And the reason for that was because schools were closed. So children weren't going to school. Therefore, there was nobody reporting it. So initially, it looked like it was going down when that actually was the opposite. There's a lot of shame that's associated with caregiver stress, that they feel angry, they feel like they're missing out on things. They even feel guilty if they feel happy. They feel shame that they feel happy. They don't deserve to feel happy because their loved one that they care about, let's say, is not having a good day. There's also increased risk for substance abuse for caregivers. And again, this substance abuse during COVID with caregivers, with everybody being in the home, this increased considerably. All right, so a little bit about stress before we get into the components of stress during COVID. Stress is basically any change where you have to adapt your response to it. And when you don't adapt your response to it, it's kind of like you hitting a wall, and this is basically when stress occurs. There's 3 main components of stress: physiological, cognitive, emotional, and behavioral. Physiological are things like shortness of breath, racing heartbeat, feeling sweaty, feeling clammy. Cognitive and emotional are exactly what it says: thoughts, feelings, images associated with perceived danger, feeling out of control. And then behavioral are the actual responses. So anything I can see, if I'm videoing you, if I can see it, it's a behavior. If you're scared, that's an emotion. I can't see it with a camera. But if you're running, I can see that. So that's a behavior. So the way that these things interact is what develops stress for us. So the physical, I already talked about this: racing heart, grinding teeth, increased blood pressure. Thinking. These are all the things that go through our mind: worry, memory problems, confusion, feeling out of control, difficulty making decisions. Again, all of these things escalated during COVID. So again, they're there before, and then COVID came and all of these things heightened. Emotional things like, I can't do this on my own. I'm not a good wife, mother, sister, brother. I'm angry at my spouse. I'm angry at my child, my parents. Feelings of resentment, feeling extreme fatigue and agitation at the same time, which is a terrible feeling, especially when you are home and you can't get out to get some respite, or the people in your house can't get out to give you a break because of COVID. So obviously that leads to increased irritability and anger, which is also where the substance abuse increase came in, and also the increased rates of child abuse and domestic violence. So behavioral, again, things that we look for when you're dealing with stress and anxiety: withdrawing from others, which during COVID was difficult to piece out because you can't be around people. So what I would do is I would look for things like bathing, getting dressed, eating. Are you doing things in the house like cleaning like you normally would do, your laundry, Are you putting decisions on hold that you normally would have done? Are you sleeping more or sleeping less? Are you using more alcohol, using less? So I couldn't really use what I would normally use to assess any behavior changes because of COVID. So I had to look for things that were kind of more home-based and more day-to-day activities of daily living type tasks. So warning signs of stress and anxiety during COVID that are important to look for. If you feel the need, and this is from a caregiver's perspective, if you feel the need to hurt or yell at the person that you're caring for, if you find that you're depending too much, like I said, on alcohol or drugs or prescribed pills, I just want to make sure that I mention this. Substance abuse is not just alcohol and recreational drugs. Oftentimes in a caregiving situation or when you're dealing with an illness, you have access to certain medications, and this is where kind of taking more than what's prescribed to you comes into play, because this, a lot of times as far as substance abuse goes, not only gets overlooked, but oftentimes isn't necessarily viewed by many people as an addiction problem. So again, how do you assess for depression and anxiety in both caregivers and people with epilepsy during the pandemic? The ADLs, or activities of daily living, which I spoke about: bathing, eating, sleeping, and then things like shopping, bill paying, cleaning, following up with appointments. Are you missing your doctor's appointments? Are you missing virtual appointments? Are you not paying your bills? Things that you can do from home, but that you're not following through with. Also keep in mind that depression and anxiety is going to look different based on gender. Men and women tend to deal with their depression and anxiety a little bit differently. Males tend to get diagnosed a little bit less, not because the symptoms are less, but just because they tend to reach out for help less, although that is changing and has been changing over, I'd say, the last 10 to 15 years. They're more likely to self-treat, meaning they're more likely to use alcohol and drugs, and they have fewer support people because they don't tell as many people. So not as many people know. So some more signs and symptoms so that you know what to look for in yourself and in your loved ones. Sadness and crying that won't go away. That's disproportionate to the context. So obviously during the pandemic, if you have stress, if you have anxiety, I am sure there are times where you broke down and cried. Completely normal, appropriate to context. It's when you're sighing and crying and sadness don't go away. When your reaction to situations is disproportionate to the context. So increased irritability, ongoing fights with family members and friends. And I don't mean your standard, bickering that goes on constantly every night at dinner. This is something that would have been a notable increase since the pandemic started. There's no break from it. And let's say your child drops a dish on the floor. Normally you tell them, be careful, don't do that. What this is saying is that maybe, you take the dish and you throw it against the wall, or you scream at them, or you send them to the room, or you do something that you wouldn't normally do in response to that. Physical sickness, this is the big one, because this can get confusing when you are already dealing with another physical illness, because it's hard to separate the two. But ongoing headaches, digestive problems, and chronic pain are three major things that occur when there is a ton of stress and anxiety and depression in somebody. So it's very important to kind of take a physical inventory of yourself and determine whether these symptoms are more likely due to stress and anxiety of the pandemic or due to something else, because you'll treat them differently. A call to your neurologist or your gastro doc can manage those symptoms, but if it's something psychological that's going on, you want to make sure that you address that. So it would be something that's above and beyond, or something that's disproportionate to the context. Some things that you can do during COVID to help manage these symptoms. PMR is progressive muscle relaxation. I do this a lot with my patients. Breathing retraining, so making sure that when you breathe, your stomach is filling up, and when you breathe out, your stomach is going in. This gets more oxygen to your lungs. Guided imagery, proper nutrition, exercise. Now, exercise during COVID, we had to get creative. I'm a tennis player. I play tennis 4 times a week at minimum. I couldn't do that. So I had to improvise. So I don't work out. I hate working out. So I found classes on Zoom that were kind of workout classes, just to give myself something to do. And I did them on Zoom. So we had to get creative and modify these things, or maybe just take a walk up and down your driveway. You have to take your, and this was very important for people, your pre-pandemic routine and modify it as much as you need to during COVID, but make sure that there is still some bridge between pre-COVID and during COVID, because you want to maintain as much of your pre-pandemic routine and structure as possible and as safe as possible. Scheduling of pleasurable events. Again, this may need to be modified. Let's say you had movie night with your girlfriends every Friday night. You can't do that now. So watch Netflix together on Zoom, or FaceTime and watch a movie together while you do that. Different types of behavior therapies, cognitive behavior therapy, acceptance and commitment therapy are great ways to manage anxiety and depression. That is how I practice. And it's really about sitting with discomfort, tolerating it, and not doing things to get rid of it, because that makes it worse. And medication, again, medication is a personal preference. If you find that during COVID, your anxiety and depression are getting too much for you, it's important that you speak to your neurologist first, because you want to make sure that any type of antidepressant or anti-anxiety medication does not interfere with your other medications that you're taking. So I already spoke about this. The other thing that's super important is, because of the lack of socialization and social distancing and restrictions that are in place, and because of compromised immune systems, it's very important to keep communication open with your physician. Ask questions, email them, record important information. If you think you'll remember it later while you're driving, you won't. Write things down in your phone. I have my notes section in my phone. I write everything down in that. Bring family members with you to appointments, or have them sit in on your Zoom calls or your FaceTimes, because in general, we're anxious at the doctors. We don't remember everything. During a pandemic, we're even more anxious. So try to have somebody with you, or take as many notes as you can. You want to also, as I said, maintain your prior schedule during the pandemic. So it would be very helpful for yourself, for caregivers, for family members, to make a list of all the not just daily routines, but all of the things that have to get done. Doctor's appointments, medications, what times, what dosages, everything that you do on a day-to-day basis, it should be written out somewhere, because when stress hits, we forget. Our concentration and our memory is the first thing to decrease when we're anxious. So make sure you have everything written down. Our brains tend to take shortcuts during times of stress. Pandemic is definitely a time of stress. So make sure you write everything down, even if it seems redundant. Your brain will thank you later. Use all aspects of your support network. This does not have to be just family. It does not have to be friends. Use your neighbors. Use your college roommate that you haven't spoken to in 10 years. Use as many people as you have access to. When you make your list of things that need to get done, depending on your stress level, depending on whether you have COVID or not, depending on where you're at in your epilepsy diagnosis, identify tasks that are easier for you in that moment to do, so that you feel a sense of mastery, so that you feel that you've accomplished something, and delegate the others. Some people have difficulty delegating tasks to others because they like things done a certain way. I get that. However, you want to make sure that during added times of stress, like a pandemic, you delegate where you can, because the last thing you want to do is become overwhelmed, because then the stress affects your immune system, and if your immune system's low, and COVID, and it's just this big vicious cycle. So delegate where you can, do the things that are easy for you so that you gain a sense of mastery. This we already know, but keep an emergency contact list with you at all times. And respite. You must, even though we are in a global pandemic, you must find time. This is both for people with epilepsy and their caregivers and family members. You must find time to take care of yourself, whatever that looks like for you. All right, so I don't know how I am on time, but I'll get through this part really quickly. Because things changed drastically as far as socialization during the pandemic, family visitations, family vacations, celebrations, holidays, traveling, everything had to be revised. So what I recommend for people in general is to find the things they can control during this uncontrollable time in our lives and zone in on the things that you can control, no matter how small they are. Because even if you can control one tiny aspect, it gives you this sense of calm, it gives you a sense of mastery, and that is so important because it helps to reduce stress, which helps to reduce, feeling sick, which helps to reduce not compromising your immune system, and on it goes. So it's so, so important. Always look for the things that you can control. As far as planning during the pandemic, this was really difficult to do. And for people that tend to be planners, this was something that I had to get used to. This was something that a lot of my patients had to get used to. And for people who have epilepsy, there is a lot of planning that has to go into some of the things that you do on a day-to-day basis for safety reasons, or for medication reasons. And so when you can't plan ahead, it does take a toll on your day-to-day. So again, this goes to look for the things that you can control, look for the things that you can plan ahead of time. So I put in here, if you watch a TV show every Friday night that you scheduled, or you've scheduled an outing with friends every Friday night, instead watch a TV show with them on Netflix. Do something. Maintain the socialization aspect. You can control that. We can't control how we do it, but we can't control that we can't go out, but we control how we do it in our household. And so you can plan for a Friday night because you're doing it in a safe environment. So it's important to plan realistically, plan safely, and keep as much of a routine as possible and maintain your socialization. This is the big one. Do what is best for your family. There is no right or wrong, and what's best for my family is not going to be what's best for your family, and so on and so on. So be careful of the inner judgment that you're placing on yourself when you see another family who has someone who is managing their epilepsy different than you. Their caregiving styles are different than yours. That may work for them during the pandemic, but it won't work for you. And then this I put in every presentation I think I've ever given. Ask for help. You must ask for help. You don't want to get caught up in the catch-up game, because the catch-up game is a recipe for anxiety. Asking for help does not make you weak. Do not lose sight of who you are. If you need respite, I tell people all this, and people say they need respite, they feel guilty. I tell them, feel guilty, and at the same time, take a break. Feel guilty, and at the same time, sit in your room and watch a show. If you wait to not feel guilty, you'll never do it and you will get overwhelmed. But I promise you, if you sit, give yourself 5 minutes, you will feel better. That guilt will subside. And build yourself a safety net. We know from years of research that the best predictor of coming out of anxiety and depression, coming out of a stressful situation, dealing with any type of medical illness is social support. That's the biggest thing. So that is something that I always recommend to people. Always have a safety net. And that is it. And I'm happy to answer questions.